According to online journal MDP, about 50% of pregnant women use paracetamol, making it the most used drug for self-medication in Nigeria. Emergency illness accounts for 48.8% of self-medication among pregnant women. Body pains account for 44.9% of illnesses that prompt self-medication. Welcome to another edition of Health Matters, our television health program on OSRC television. My name is Damilola Agunloye, and today on the program we'll have an interesting topic to discuss. It is what we practice every day, unknowing to us. Talking about self-medication. Yes, self-medication, we'll be looking at the do's and don'ts of medication. And to talk about that, I have a guest in the house with me, talking about Pharmacist AB Ofiyesinka. So you're welcome to Health Matters on SRC Television.
Thank you for having me. I'm glad to be here.
You're welcome once again. So we want to talk about self-medication, and we want to talk about the do's and don'ts of medication. Firstly, what is self-medication?
Thank you very much.
You're welcome.
Self-medication, as it were, is using drugs without the proper prescription of a physician or a pharmacist. You don't just use drugs. You don't just go to the pharmacy and get drug and use. That is the simple definition of self-medication. Taking drugs yourself without prescription of the physician or the pharmacist.
Okay, so let's talk about a prescription. How often should anyone use a medicine? Should you use your drug?
Thank you. How often means depends on the condition and also on the medication. I'll explain. If you have, for instance, the common one, malaria, there is a regimen. It has to be taken for so days. For instance, malaria is to be taken, anti-malaria is to be taken for 3 days. So if you don't know, you will just take anti-malaria. Some people will say, I've taken one and I'm fine. That's self-medication. So the doctor or the pharmacist who are custodians of these drugs to tell you have to use this drug for so certain number of days before the parasites that caused malaria will be eliminated from the system. So how often depends on the condition, depends on the medication.
Does that mean if you are feeling somehow, maybe you're not feeling too well, you can't just go to a pharmacy and get maybe a paracetamol or something?
Yes, that's why we have distinguished drugs. We have classified them as over-the-counter and prescription drugs. So paracetamol falls into the category of over-the-counter drugs. These are drugs that you can walk into a pharmacy and say, I want to get paracetamol. It does not need a prescription, but please be guided on the use.
We should not overuse it, because some people, any slight headache, paracetamol. Any this thing, paracetamol. Maybe body ache, paracetamol. What advice do you have for such people?
Very, very good.
I think it's part of self-medication.
It is.
Yeah.
So there are some people that will walk into the pharmacy and say, sir, please, I have headache. What is the cause of the headache? That's when a professional will come in. A professional will tell you, it is not every time you have a headache and use paracetamol. Sometimes just take a nap. It's because maybe you have been stressed for some hours, and that is what is inducing that headache. So sometimes when I see people complain of headache, I would love to make money by selling my paracetamol. But I will tell you professionally, if in the course of our interaction you say nothing caused you, or maybe you have been stressed over the day, in the course of the day, maybe at work, or I will just advise you to go home, take a warm bath and sleep. And you'll be fine. It is not every time you use paracetamol. I want to tell you, paracetamol is also a very dangerous drug. The adverse effect of paracetamol is hepatotoxicity. I will explain. Hepatotoxicity means it's toxic to the liver.
Wow.
So if the active ingredient of paracetamol, which is 500 milligram, and the adult dose is 1 gram, to be taken every 8 hours, and if you take more than that, you are damaging your liver.
But in some cases, when you, even with prescription, when you're given a malaria drug,
Yes.
the doctor will include paracetamol that you should be taking twice in a day. Maybe after taking the malaria drug in the morning, then in the afternoon take paracetamol, in the night take paracetamol. Any effect on
that is ideal, because
ideal.
scientists have done the research, they've done the findings, done clinical trials before coming up to say use thrice daily. It is not for us as pharmacists who don't use 3 times daily. It is unit dosing.
Okay.
So if you take it every 8 hours in a day, if you take 6 a.m., maybe the next 8 hours you take another dose of 2, then by 6 p.m. you take 3. That's 3 times a day.
Yeah.
But we will prefer to say every 8 hours.
Okay.
not
Why
3
is
times.
that?
So that you will know. Because if we tell you 3
Like
times,
spacing.
if we tell you 3 times, you can take it by 8, then by 12 take another dose.
Okay.
There is a therapeutic index.
Okay.
There is what we call a half-life in drugs. The half-life of a drug is the time the drug it will take to eliminate half of the drug in the body system. If it has not eliminated it and you take another one, the drug becomes toxic to your system. There are 2 areas. Therapeutic, it is a graph.
Okay.
A little above that therapeutic index is lethal, become toxic. So it is always advisable to take it as instructed, or as advised, or as prescribed.
Okay. And now, before taking any drug, is this advisable to eat before taking your drug?
Yes, it's a yes and no.
Let's say that.
It's a yes and no. There are drugs that interact with food,
Okay.
and there are also drugs that are better absorbed without food, on empty stomach. I will give you an instance. There are some of our drugs that if you take without food, they will encroach the upper mucosa of the gastrointestinal tract, the GIT, and that's why some people today, they said I have ulcer.
Oh.
Their ulcer was not caused by anything, it was caused by drug. If you take, for instance, ibuprofen on empty stomach, you will feel pain in the GIT.
Okay.
If you take diclofenac, if you abuse those drugs, you will have ulcer. It's because they are absorbed through the GIT. So taking that one you are expected to take such drugs with food. There are some drugs, and for instance, there are some anti-malaria you are supposed to take with milk for easy absorption. It aids the absorption of the drug.
Anti-malaria with milk.
Yes.
Oh.
Then there are some drugs, we call them proton pump inhibitors. We advise that you take, for instance, omeprazole.
Okay.
It's an ulcer drug. You take it some 30 minutes before food,
Okay.
because the food, if you take it with food, it will interact. So it's a yes and a no. It depends on the medication and the condition you are managing.
Okay. Well, so like a drug like paracetamol can be taken anytime, even with food or without food. Yes or no? Because you know why I kept on mentioning paracetamol?
Because it's the most abused.
That is, it's the most abused. Yeah.
It does not have such effect, but we will still advise for like paracetamol, take with food. But even if you take without food, it's safe.
So let me ask, for how long do I need as a patient? For how long do I need to take a medicine?
Yes.
Like
For
the
how
medicine-
long?
Yes.
The time.
The time.
Like I mentioned earlier, there is, for every disease condition, there is a regimen. The regimen is the dose, the dosage, the frequency, and then the time of treatment. Like I mentioned earlier, malaria management is for 3 days.
Okay. Talking about anti-malaria drugs, some will say after taking anti-malaria drugs, maybe after the completion of the drug,
Yes.
maybe within 3 days, the thing will just come back again, or few days. What could be then later the person will even go back to the pharmacy again and get another one and said, I used a particular product and it's not working for me. Maybe I should buy another product. That's a risk.
It happens.
So
what happens is, number one, we know our system. So that's why we always advise.
Maybe what works for A might not work for B.
Definitely,
what do you think?
Definitely. That's why we advise that my friend used this does not mean I should use this, because we have different physiological makeup. So if you take an anti-malaria and it did not work for you, where did you get it?
Well, doctor, will continue after the break. We'll be taking a short break. The program is still Health Matters on SRC Television. We'll be right back. Welcome back to Health Matters, your TV health program on OSRC Television. And today we are looking at self-medication, the do's and don'ts of medication. And with me, I still have a pharmacist, Abi Ofiyesinka, in the studio with me. So before the break, we were talking about what a particular drug, that like repeating drugs twice. Let's talk about the side effects of this.
Yes. Talking about side effects, before we'll go there.
Okay.
We're somewhere.
Okay.
So if you use a particular anti-malaria and it worked for you, it does not mean to work for me, because our physiological makeup differs. A drug you took that is easily absorbed might not be absorbed easily for me. Maybe because there are so many factors: age, renal function, hepatic function, GI functions, so many things, rate of absorption. So if you are taking a particular medication, I am not expected. So that's why, again, if you want to take a medication, please go to a professional. There is only one professional in the healthcare delivery system that is licensed and that is certified to handle drugs, who is the pharmacist. Go to a pharmacy and insist on seeing the pharmacist. It will tell you why you should use this, why you should not use this. Every drug has side effects. Side effects are effects, undesirable effects, but they are mild. But there is the other part, adverse effect.
Okay. Now, in a situation where I forget to use a drug at a particular time, so what should I do?
Don't panic.
Okay.
Don't double up. Don't rush to say,
like maybe you were asked to use a drug by 8 o'clock.
8 o'clock.
And you were busy, you couldn't meet up with the time.
Yes.
And the next thing, by the time you check your watch, 3 p.m.
Yes.
So what should be the next thing?
Like I mentioned.
Okay.
Don't panic.
Okay.
Do not say, oh, I was supposed to take it by 8 and another one by 3.
Yeah.
And I will now say, okay, I will have to use the 2 to make up. No. First, you have missed one. You have skipped a dose. Don't worry. If the time is not close to when you are supposed to take the next one, you can take the medication as soon as you remember. Otherwise, wait till the next one. We are expected to take the next dose and use it. And also contact your pharmacist.
Okay. You mentioned it earlier, this over-the-drugs.
Over-the-counter drugs.
The over-the-counter drugs. What are these over-the-counter drugs?
Yeah.
Just any drugs, you just go to the pharmacy and give me this so thing. It's risky. You are putting your life at risk.
Yes.
Then what happens to the pharmacist? I mean, yes, in the pharmacy, without they are attending to that patient without a prescription. Is it right? Let me put it that way.
Yes, you mentioned
Over-the-counter drugs. Yeah.
It is right to give over-the-counter drugs to a patient
because you want to make a sale.
No. It is over-the-counter. It does not need prescription. Okay. But there are drugs that are prescription-only medicine. We call them POM, prescription-only medicine. Okay. Then over-the-counter, paracetamol, over-the-counter drugs we can give you. There are some anti-malaria, as rampant as malaria is. There are some anti-malarials that we give over the counter, but there are some that are prescription only. Okay. A pregnant woman is not expected to use some anti-malaria. Okay. Because it can cause premature abortion. It can affect the fetus in the womb. So they are not at certain age, at certain stage, gestation stage, you are not supposed to. Also the aged. What about the children? The children. We classify two special groups, pediatrics and geriatrics, because their liver function is not, the liver is not functioning optimally. So as a child, you are not expected to give certain medications. We specialize them. They call them special groups. Then when it grows to the aged, at that age, the liver is not functioning optimally, the kidney is not functioning, and these are organs that metabolizes these drugs.
Yeah, there are some people that finds it difficult to swallow tablets or something. Any alternative for them?
There are so many.
Okay.
There are so many.
Especially if the tablet is bitter or something, or big, or immediately they'll feel irritated.
Some want to even use a bar
and put it inside
them.
Yeah.
Those are things I just mentioned that can affect the absorption of the drugs. Okay. So there are so many routes of drug administration apart from the oral. That one I would take with water is what we refer to as oral use of drugs. There is intramuscular injection. There is intravenous through the veins. There is rectal through the anus. There is vaginal. There is inhalation. So we were earlier talking about asthma, people that have asthma. There are oral medications, but that inhaler, if you give it at once, it will get faster onset of action. It will open up the airways and allow him to breathe freely. But if you want to take oral salbutamol, for instance, it will take this process of absorption, metabolism, excretion, distribution, those processes before it will get the therapeutic effect. It will take time, but inhalation, within seconds or minutes, it will start working. Same as intravenous. So there are so many routes of drug administration.
Thank you very much, Dr. AB. And now let's talk about the do's and don'ts of medication. What are the do's and don'ts?
Thank you.
Yeah.
Do's,
don'ts.
Yeah. Let me start from the don'ts. Do not take a drug from another person. It worked for the person does not mean to work for you. Okay. Always take your medication as prescribed by the doctor. Don't increase your dose to get more effect, because when you do, the more does not mean it will be better. The more is only more dangerous. Okay. Don't take more for yourself. Don't self-medicate. It is dangerous to your system. It is dangerous to your health. Keep all drugs out of the reach of children. Okay. Keep all drugs out of reach of children and your pets around. And again, if you are refilling drugs, maybe most times when they go to the hospitals, they give them monthly medications. So they take it daily. It is also advised that you take your medication as anytime you are taking it. For instance, if you are taking it in the morning by 8, it is advised that you take it at that same time.
Okay.
Every day. Take it at that same time. And again, don't run out of your drugs before you refill.
Okay.
So if in a month you want to, and they have given you 30 for 30 days, maybe when it remains like 5, you go to the hospital, you go to the pharmacy and refill. Don't stop, or don't stop or change any of your drugs without your pharmacist. Let me also mention this, very important. Do not take an expired product.
Okay.
Do not take any drug. A pharmacist will not be angry if you go to a pharmacy, a professional, and say, the drug you gave me has expired, and you will not always find it in a pharmacist on premises. Pharmacists take stock of their drugs every day. It's very safe to use. When you are going to the pharmacy and they give you the products, check. The pharmacist will not feel embarrassed. He will be happy that you are aware. We want to talk to an enlightened public. We want to talk to people that are aware of their they are aware of their health. So when you come and say, when is the expiry date? It does not feel embarrassed. It does not feel bad. It will tell you it has not expired. But it is your right to ask. Also, it is your right to ask, why am I taking these drugs? What are the possible side effects I am going to experience using this drug? It is your right to ask.
I would like us to talk about the potential risk of self-medication. The risk. What are the risks?
Risk, very many. Like I mentioned, liver damage. Paracetamol, as it's common as it is, can damage your liver. And the moment your liver stops working,
it's a problem.
No, it's not that it's a problem, you're gone. The risks are enormous, so it is never advised to use drugs without the advice of your physician or your pharmacist. Do not take drugs that are not prescribed. Do not take drugs on your own. The risk is just very enormous.
Thank you so much. Well, we have had this all from pharmacist today, pharmacist AB Ofiyesinka. Yes, we talked about self-medication, the do's and don'ts of medication, and I'm sure you must have learned a lot. We talked about the do's and don'ts, what you should avoid, and please, as an in addition, it said if you visit a pharmacy, make sure you check the drug, check the expiry date. This is important for you. Well, I want to appreciate you for watching this week. Until next week, when I'll be coming your way again. But before then, pharmacist, any word of advice to our viewer out there?
Thank you. Very importantly, I need to mention that in this present economy, we should all have health insurance.
Thank you very much.
Go to Ondo State Contributory Health Commission and get an health insurance plan for your family.
You've heard it all.
Thank you.
I remain yours sincerely, Damilola Hagnoe, saying, remember, health is wealth. Take good care of your health. Bye for now.